Welcome to the Medical Terminology Podcast. This episode is Chapter 3, Part 5, Procedures. In this last episode for Chapter 3, I'm going to go over the procedures that tend to be troublesome, difficult to pronounce, or difficult to remember on tests. And I'm going to group these kind of thematically. You know, we have procedures that are diagnostic. We also have procedures that are treatment procedures. And what I'm going to do is combine the diagnostic and treatment procedures topically, that is, by the part of the body they deal with. First of all, we're going to look at joint procedures. The first one that often gives trouble is arthrolysis. A-R-T-H-R-O-L-Y-S-I-S. That's composed of arthro, A-R-T-H-R/O, and elysis, L-Y-S-I-S. If you remember from the earlier episode on word parts, elysis means surgical loosening. And I will tell you it can also mean loosening in a pathological sense, like there's a degeneration, there's a breakdown of something. But in this context, arthrolysis means a surgical loosening. And it is a surgical loosening of an ankylosed joint. That is, a joint that has ankylosis. Do you remember what ankylosis means? Well, that's a joint that's become stiffened to the point that it's fused. It's totally immovable. So arthrolysis is a procedure to correct that. If you have a fused joint, it is immovable, you would perform an arthrolysis, which would loosen it. Now the next procedure is the opposite of arthrolysis. The next procedure is arthrodesis. A-R-T-H-R-O-D-E-S-I-S. And that's composed of the word parts arthro, A-R-T-H-R/O, and desis, D-E-S-I-S. If you remember from the episode on word parts, desis means a surgical stiffening. So this term means a surgical stiffening of a joint that's been loosened by disease. And usually that would be rheumatoid arthritis. Severe arthritis can cause the degeneration or the breakdown of a joint. And usually the term that's used for that kind of degeneration or breakdown is osteoarthrosis. We have the suffix OSIS, which normally means abnormal condition, but an osteoarthrosis generally means it's the degenerative breakdown. Okay, so going back to arthrodesis, we have a joint that has degenerated, it has osteoarthrosis, and we're going to treat it by stiffening it. And stiffening it would be arthrodesis. Okay, 3 terms relating to joints. Now the next group of terms relate to osteoporosis, either diagnosing or treating it. The first one is bone density testing. Bone density testing is a very general term for any procedure that would be used to determine the loss of bone density. Now the textbook shows us 2 specific kinds or examples of bone density testing. The first one is a screening test. And screening tests are tests that are usually simple, they're quick, they're painless, they are used to get a quick determination of if there's a cause for concern. And a screening test for osteoporosis is ultrasonic bone density testing. It's a test that uses sound waves to measure the calcaneus bone. Calcaneus is the medical term for the heel bone. And the way this works is there's a little machine, a device, someone puts their heel in the machine, it scans it using sound waves and makes a quick determination if there's a problem relating to bone density, if there's a cause for concern. If there is, more exacting tests will be performed. The more exacting test that is presented in our textbook is dual X-ray absorptiometry. That's a mouthful. Dual X-ray absorptiometry. ABSORPTIOMETRY. And this is a radiographic measurement of the spine and hips to measure bone density. Radiographic refers to X-rays. So they're taking an X-ray of the spine and hips to determine if, or more specifically, how much bone density has been lost. Well, the final term here is a treatment procedure. And this term is percutaneous vertebroplasty. Percutaneous, Percutaneous, vertebroplasty, Vertebroplasty. Percutaneous means through the skin. Vertebroplasty would mean surgical repair of the vertebrae. So what really does this involve? Well, this is a treatment for osteoporosis-related compression fractures. Do you remember what a compression fracture is? Well, a compression fracture is when the bones push against each other and then they fracture or collapse. And we usually use the term in relation to a vertebral fracture where the vertebrae have become so weakened that they collapse under their own weight. Well, if this happens, we can do a percutaneous vertebroplasty, and that's where cement is injected into the spinal column in order to stabilize it. So that would be a treatment for osteoporosis compression fractures, percutaneous vertebroplasty. Okay, and the last group here I have for you relate to bone fractures. Sometimes we have a bone fracture or an injury to the bone that heals incorrectly, and we might have to surgically break the bone and then reset it so that it will heal, grow back together correctly. And the term for that is osteoclasis. Osteoclasis. Osteo means bone, of course. Clasis, Clasis, means surgical breaking. And again, I like this suffix because it sounds like what it is. Clasis sounds like a clash or a shattering or breaking. Osteoclasis is the surgical breaking of a bone. Then there are two more terms related to bone repair that often get confused. The first one is internal fixation, INTERNAL, fixation, FIXATION. This is a treatment in which plates or pins are placed directly into the bone to hold the broken pieces together. This hardware is not removed after healing. So this is like a surgical procedure where they are opening up the body and they are surgically placing the hardware into the bone, inside the body, to stabilize the break, close it all up, and then it stays in there. Now that's different from external fixation, EXTERNAL, fixation, FIXATION. This is a treatment in which pins are placed through the soft tissues and bone so that an external appliance can be used to hold the broken pieces in place. And this external appliance is removed after healing. Now where I think people get confused on these terms is external fixation when it says the pins are placed through the soft tissues and bone. Well, the hardware is going inside the body. The difference is It's being pushed in from the outside. If you look at the drawing in the textbook, the pins are being pushed in from the outside. It's going through the skin, the fat, the muscle, down into the bone. Then the external fixator is on the outside of the body. It connects to these different pins. It creates a rigid structure with the bone, keeps the bone together so that it can heal. Once it's healed, they pull the hardware out. That's different from placing the plates or pins directly into the bone. That means we're surgically opening the body up and putting it into the bone to hold the pieces together. Okay, so just be careful of your reading and interpretation of the description there when you're studying this and also when you're taking a test. Okay, well that covers the major troublemakers under procedures. Now I'm going to go ahead and quiz you over them. Number 1, what is the term for the surgical stiffening of a joint? Well, that's arthrodesis. Arthrodesis. Number 2, what is the term for the surgical replacement of a joint? Well, that's arthroplasty. Arthroplasty. And again, arthroplasty from the word parts means surgical repair. Well, yes, that's what's going on, but typically we really use the term to mean a joint replacement. What is the term for the loosening of an ankylosing joint? Okay, to answer this question, you first of all may need to know what ankylosing means, or at least not be confused by that term. What is an ankylosing joint? It's one that's been stiffened to the point that it's fused. It will not move. Okay, so we're going to loosen this fused joint. So what is the word for that? I hope you've got arthrolysis. Arthrolysis. That would literally mean from its word parts, surgical loosening. What is the term for the surgical breaking of a bone? That's osteoclasis. Osteoclasis. What is the term for the screening test for osteoporosis? Well, that's ultrasonic bone density testing. What is the term for a fracture treatment in which pins are inserted through soft tissue into the bone so that an appliance may be used to hold the pieces together while the bone heals? Well, that is the external fixation. We're using this appliance. That's external fixator. Okay, what is the term for a treatment for compression fractures that involves injecting cement into the spine? That is percutaneous vertebroplasty. Percutaneous vertebroplasty. Vertebroplasty. Okay, and finally, what is the term for the radiographic measurement of the spine and hips to verify the presence of osteoporosis. Okay, the test that will verify osteoporosis is dual X-ray absorptiometry. Dual X-ray, two words, D-U-A-L X-R-A-Y, and then absorptiometry is ABSORPTIOMETRY. Okay, well, I hope this helps you with your studying, helps you sort out some common problem areas, and I wish you luck in finishing up Chapter 3 and taking your tests. This ends this episode of the Medical Terminology Podcast.